Our next guest will be joining us online, and it's Mr. Mohamad Motevalli. So do we have a connection? Can you hear us, Mr. Motevalli?
Yes, can you hear?
Yes, we can hear and we can see you. So you can please proceed with your presentation.
Good. Do I need to share my screen or it's already done?
Yes, please share your screen. Okay, we can see your screen now.
Yeah. So hello, ladies and gentlemen. Thank you for having me today. My name is Mohamad Motevalli from University of Innsbruck, Austria. The study that I am presenting today is a part of an Austrian-wide project called From Science to High School and University that focuses on healthy and sustainable lifestyle behaviors of young adults, with a particular emphasis on diet type. The title of my presentation is Lifestyle Behaviors of Vegans, Vegetarians, and Omnivores in Austrian College and University. So as you can see, the main focus is comparison between vegans, vegetarians, and omnivores. As you know, health is the greatest wealth, and no one can ignore the importance of a healthy lifestyle in almost all aspects and details of life. Evidence shows that 38% of our health is affected by our behavior, while medical care contributes only 11% to our health. Despite these facts, unfortunately, the money that people and governments spend on medical care is much more than health behavior. These data clearly shows that prevention is much more important than treatment in medical issues. According to the American College of Lifestyle Medicine, there are 6 areas of lifestyle, including physical activity, diet, substance abuse, sleep, relationships, and stress. The World Health Organization reports that lifestyle behaviors play a significant role in the prevalence of non-communicable disease. These diseases are the main cause of 74% of all deaths globally. And the problem is much more critical in low and middle income countries. The bad news is the prevalence of non-communicable diseases is increasing worldwide. And for example, the prevalence of obesity has nearly tripled during the 50 years ago. But the good news is that the non-communicable diseases and the associated risk factors, such as obesity, are preventable and even reversible. A European-wide study reports that only 6% of European people have a healthy lifestyle. In this study, there were 5 criteria to define a healthy lifestyle. 1, meeting the recommended level of physical activity. 2, acceptable intake of fruits and vegetables. 3, no smoking. 4, low alcohol intake. And 5, good quality of sleep. So as you can see, this is not a fully healthy lifestyle, but an acceptable healthy lifestyle. And when we compare different countries across Europe, we see that Austria has not a good situation, and only about less than 3% of Austrian people have a healthy lifestyle. If we focus on the component of lifestyle, first we can start with physical activity. This physical activity is one of the most important area of lifestyle, and WHO recommends that adults should engage in a weekly amount of physical activity by about 150 minutes per week, that is better to be distributed in 3 different days. And in Austria, data shows that people have an acceptable level of physical activity, and 75% of adults in Austria meet the PA or physical activity recommendations. And as evidence shows, to maximize health benefits, it's better to combine physical activity with a healthy diet. The next part is healthy diet. That is very important also for sustainable lifestyle and health. Evidence shows that vegetarian and vegan diets are recognized as one of the most appropriate dietary strategies that people can follow to have healthy diet and nutrition. And the prevalence of vegan and vegetarian diet in Europe has been estimated about 10% with an increasing trend. And again, to maximize health benefits, it's better to combine healthy diet with other lifestyle components like physical activity. And regarding substance abuse, data shows that smoking accounts for about 8.5 million deaths everywhere globally. And this number for alcohol intake is about 1.5 million. About more than 20 types of disease and injuries worldwide are linked to substance abuse. And this problem is much more critical than adults and also in men compared to women. The target population of this study are students and academic staff of Austrian colleges and university. And there are some reasons that we decided to choose this population. University life is crucial in shaping and developing health behaviors. And university life is linked to sedentary nature. And most of people, students and academic staff, have sedentary nature. And also psychological distress is very popular among this population. And data shows that only 50% or half of university population meet the physical activity recommendations. And also the prevalence of unbalanced diet is higher than normal populations. And this directs us to go to the aim of this study. And this study aimed to investigate lifestyle behaviors of participants based on dietary groups. And in follow, we analyze potential associations with PA or physical activity behaviors, as well as socio-demographic characteristics. We use cross-sectional design as a study design, and we conducted an online survey to do that. This study was nationwide, and in Austria we have 102 university and colleges, and more than half of this number participated in this study, and more than 6,000 students and more than 1,000 academic staff participated this study, and we collected data in 2021. A comprehensive profile of data on social demography, anthropometry, and academic status, as well as lifestyle behaviors, were measured, and all data were compared based on different diet types in 3 categories: omnivores, vegetarian, and vegan. And we use different types of statistical methods to analyze the data. In the sample of students, there were 65% females, and the prevalence of vegan and vegetarian diet was totally about 28 or 29%. That was much more higher than the normal population. And the prevalence of overweight and obesity was about 80% in the sample of students. In the sample of academic staff, the prevalence of vegan and vegetarian diet was a little bit less than students, but still higher than Normal population, it was about 50%, and about 32% of participants or university professors were overweight or obese. In the sample of students, as you can see here, the prevalence of vegetarian and vegan diet was was higher in females than males, and also in graduate students than bachelor students. And also participants or students living in the urban area has a higher prevalence of vegan and vegetarian diets. But there were no significant associations in terms of nationality. In the sample of academic staff, significantly females had a higher prevalence of vegetarian and vegan diet. And also professors from out of Austria, but working in Austria, had a higher prevalence of vegan and vegetarian diets compared to Austrian professors. And no significant difference was found in employment status and also living environment in terms of urban or rural living. In the sample of students, there was significant difference in BMI values. As you can see here, participants with omnivores or mixed diet has a higher BMI, and in the sample of academic staff, also this data, we saw this data, and participants with mixed diet has a higher prevalence, has a higher BMI values. In the sample of students, here you can see vegetarian and vegan participants or vegetarian or vegan students has a higher rate of engagement in leisure time sports participation, and also vegan and vegetarian students has a lower alcohol intake compared to those who follow mixed diets. But no significant difference between dietary groups were observed in the smoking and club sports participation. In the sample of academic staff, again, vegetarian participants had a higher engagement in physical activity. And here you can see also in alcohol intake, those who follow vegetarian and vegan diet has a lower intake of alcohol compared to omnivores professors. And interestingly, here you can see in smoking, there were no vegan participants who has a smoking behavior. And no significant difference was observed in club sports participation. If we want to summarize the key findings, we can say the prevalence of vegan and vegetarian diet was about 30% among students and 50% among academic staff. And females were more likely to be vegan and vegetarian in both samples, the students and academic staff. Among students, vegan and vegetarian participants were more likely to participate regularly in leisure time physical activity. However, in the sample of academic staff, only vegetarians were shown to have a more engagement in physical activity. And participants with vegan and vegetarian diet in both groups had a lower prevalence of overweight and obesity. And in the sample of the students, no significant difference between the smoking behaviors was found. But among academic staff, vegan participants had a lower smoking rate than vegetarian and omnivores. And regarding alcohol, a lower alcohol intake was observed among vegetarians and vegans compared to omnivores in both students and academic staff. And fluid intake was more prevalent among vegans compared to vegetarians and omnivores in both students and academic staff. If we want to conclude this data, we can say that vegans and vegetarians had a healthier lifestyle compared to those who follow mixed diet. And in the sample of students, there were acceptable healthy behaviors compared to general population. These data, or we found this data again in academic staff compared to Austrian adults. They have a healthier lifestyle. And generally, we can say that diet type can influence other health behaviors, including physical activity habits. And this shows that the lifestyle habits are interconnectedly integrated, and they can have a cumulative effect. And this, the study protocol of this study has already been published, and there are two separate publications that we just published in the journal Frontiers in Public Health, separately for students and academic staff. And thank you for your attention. We had also the two other presentations, one already done and another is coming regarding this project that we are conducting in Austria. Thank you so much.
Thank you. Thank you, Mr. Motevalli, for your presentation.